Hey friends, today is going to be a very good video on AI in healthcare. AI in healthcare is making huge progress and it is a very good topic that we need to discuss. So let's get straight into it. We will continue the same format of our videos. That is, first we'll discuss about the beneficiaries and then we will go through all the important things that are happening in AI in healthcare. And then we'll finally conclude by giving some important points. So let's get first, who are the beneficiaries here? AI students, everybody who is learning about AI. BA, business analyst in healthcare, is very useful for them. Business systems analyst, quick learners who don't have too much time. They just want to learn important things about AI in healthcare. This is very good video for them. Interview attendees who are going to attend interview, BA interviews, healthcare interviews, beginners interviews. This will be very helpful. Healthcare professionals, and also simplified learners who want to learn in a quick and simplified way. This will be very useful. And students also, this will be very useful. So first of all, AI in healthcare is about giving your doctors and nurses more tools to make better decisions about your health. So in this case, when we say provider is the one who provides the healthcare, right? Many doctors are already actively using it to reduce burnouts because, as you know, when COVID came and even after that, because of all the pandemic and related diseases, doctor community has been extremely busy. So AI is complementing them to reduce burnout by doing many of their jobs already. Secondly, with the help of millions of images and supervised learning, what is supervised learning? Let's get to it here. Supervised learning is train a model, that is an AI model, to map the input to output and predict the output for new input. That is what supervised learning is all about. So in supervised learning, you're training an AI model for a certain input to produce a certain output. And from there on, it will be able to predict the output for new inputs. So AI is going to scan all these millions and millions of images. And once it does the supervised learning, machine eyes can see things that expert naked eye cannot see. So here in this case, expert naked eye is the doctors. So once the system learns the input and it's able to predict the output, machine eyes can see the things that expert eyes cannot see. That means the machine eyes becomes more efficient than the doctor's eyes. Here in our example, we are talking about MRIs, we are talking about CT scans, we are talking about X-rays, and also we are talking about scan of retina. So let's see what our progress has been made already. So first we will talk about scan of retina, right? Just by scanning the retina, AI is able to predict diabetes and blood pressure, kidney diseases, liver and gallbladder diseases, heart calcium score, Alzheimer's disease, predicting heart attack and strokes, hyperlipidemia, Parkinson's disease, 1, 2, 3, 4, 5, 6, 7, 8, just from the scan of retina and putting it through the AI model. So a scan of retina can help machine eyes, that is the AI system, detect the above mentioned diseases before any clinical symptoms can even manifest. Before the clinical symptoms can manifest, which means that before the patient comes to the doctor complaining that, so I have such a disease, just by using the scan of retina, AI can predict all these diseases. So doctors can use images of retina as a checkup for the whole human body. That is how much the AI has progressed in the field of healthcare. Let's go to the next slide. What can AI do with the help of ECG or electrocardiogram? AI can predict the age and sex of a person just by looking at the ECG. AI can predict anemia, which is, count if the hemoglobin count is less in the blood, it causes anemia. AI can predict that. Filling pressure of the heart, it's a pressure parameter for measuring the heart performance. Ejection fraction is another parameter, which is ejection fraction. If it's very low, then you're more prone to getting heart disease. Predicting atrial fibrillation and stroke risk. Hypothyroidism, difficult diagnoses, that like things that are difficult to diagnose. Diabetes and pre-diabetes, kidney diseases, all this can be predicted, all this can be identified from ECG with the help of AI. So it's a huge progress in this. Let's get to the next slide. Using X-ray, what all can be done by AI? The race of a person, like whether that person is black, brown, white, that can be identified by using AI on X-rays. Diabetes and control of diabetes, that can be done by using X-rays and AI. And now other parameters about heart. Just by using X-rays, we can get a lot of parameters about the heart. Ejection fraction, IVC dilation, aortic stenosis, regurgitation, mitral stenosis, regurgitation, tricuspid regurgitation, pulmonary regurgitation. All these heart parameters can be measured just from X-ray by using AI. Now, the next slide we have here is a pathologist. So who is a pathologist? A pathologist is someone who examines bodies and body tissues, right? So here, this is a picture of the body tissues. So just by looking at the body tissues, AI can identify driver mutation. So these are all related to cancer, right? So what is driver mutation? Changes in DNA sequence that causes a cells to become cancer cells, that can be identified just by looking at the body cells, just by looking at the body tissues. Tumor versus normal and origin. So normal cells grow, divide, and die. Tumor cells don't die, but continue to multiply and reproduce, and other abnormal cells are created, right? So tumor versus normal and the origin of the cells can be identified by the help of AI. Structural genomic changes can be identified by using AI on body tissues. And then prognosis. What is prognosis? Prognosis is the prospect of recovering from a disease or an injury. So it's basically, what diagnosis is identifying the disease, and prognosis is prospect of recovering from a disease, right? Both for diagnosis and prognosis, AI has helped healthcare in a very huge way. This slide here is talking about what are all the tools that is already available in AI for healthcare, which can be leveraged by healthcare professionals from across the world. First on is conversational AI. Conversational AI will help achieve keyboard liberation. What does that mean? The doctors and nurses doesn't have to keep typing when they're talking to the patients, because conversational AI will capture the communication, right? This saves hours of data entry time and increase face time with the patients. So it saves data entry time as well as increases the face time with the patient. Like the doctor-patient face time will be increased because the doctor is actually looking at the patient and not looking at the screen, right? And help make doctors' time more productive. Right? That's a very big jump. And now, next point is open source models in AI healthcare can be used by anyone across the world to leverage and build other models, because there is already a lot of existing open source models in AI. I hope you all already know open source models can be used by anyone free of cost, right? So there is already now, as the healthcare AI in healthcare is progressing, there's a lot of open source models already available. This can be leveraged by other professionals to build new models. So the progress is going to be even faster. Now, one place you can find such models is huggingface.co. This is the website here as well, huggingface.co. It has a lot of lots of models available in healthcare. The next one is Google's MedPalm 2. So initially it was Google's MedPalm 1. Now it's MedPalm 2. MedPalm 2 AI model has passed the US medical licensing exam, the USMLE, or the US medical licensing exam, the score of 85.4. That's a really good score for an AI model, which means that this model is almost as good as a doctor or even better than a doctor. I have given a website here if you want to learn more about it. It's already here, sites.research.google, MedPalm. And also there is a research about MedPalm. There's like more research here. These two sites are going to be very helpful. In concluding, I want to say that a patient will have 24,000 data points per day. So a patient who is admitted to a hospital, AI can capture 24,000 different types of data from a patient. So think about the amount of data that is being captured, and this data can be used with the model to gain better insight into every aspect of human health. Now, the next point here is AI can see what the human eye cannot see in identifying patterns of deterioration. So AI can see patterns of deterioration of human health better than the human eye in diagnosis and prognosis. So in all these three things, identifying patterns of deterioration, in doing diagnosis, and in prognosis, AI can see what the human eye cannot see. So AI in healthcare is here to stay. It's not going away. It's going to get even better. The point I want to just discuss about top 7 AI healthcare companies in the US. So I have given the website here directly. These are the top 7 companies. Those who are looking for jobs, if you want to go to the website and apply, you can do that. Now, if you just want to get information, you can browse to the website. Thank you for your time. And also, thank you for learning from simplified videos. For me to continue to have the motivation to create new contents like this, please subscribe so that I continue to have the motivation to make efficient, useful videos. Thank you very much. I'll talk to you later. Bye now.